Myself, Dr. Pratap Singh. I'm a student of Indian State Medical Institute. So today we will talk about a complication regarding type 1 diabetes mellitus. So now here we go. Now I will start with a case presentation. First of all, how a case presents of a diabetes mellitus patient regarding this complication, diabetic ketoacidosis. So a 8-year-old male patient came to my clinic and he was admitted with a recurrent pneumonia infection. So we gave him IV azithromycin. Now after that we checked his pulse oximeter and it was like the saturation percent of oxygen was 98%, so it was all right. After that we ordered his arterial blood gas analysis and it was like pH was 7.2, so it was slightly acidic pH, and the PCO2 percentage was 40 millimeter of mercury, so it was all right. After that the bicarbonate concentration was a little on lower side, 15 milliequivalent, so we suspected diabetic ketoacidosis, so we ordered his urine ketone urea. So there were ketone bodies in his urine like beta hydroxybutyrate, acetoacetate and acetone. After that, now I will talk about the pathogenesis, how this diabetic ketoacidosis occurs. Now first of all, as we know that in type 1 diabetes mellitus there is insulinopenia. The decreased amount of insulin is there in the type 1 diabetes mellitus. So because of infection there was increased requirement of the energy in the patient's body. So to fulfill that energy requirement, the oxidation of fat occurs. The beta oxidation of fatty acid occurs. Because of that there is generation of ketone bodies in the patient's body. Now as we know that the ketone bodies are acidic in nature. So first of all, if we will not treat this condition, these ketone bodies will be affect the brain. Why? Because these ketone bodies affect the blood brain barrier and they will cause cerebral edema. So now I will talk about the management how to manage the type 1 diabetes mellitus by giving remedies, such as we will give normal saline, we will monitor his blood glucose, and also we will give him regular insulin and control infection also. Now what are the clinical features of diabetic ketoacidosis? Now there will be protracted vomiting and there will be abdominal pain, there will be fruity odor from the patient, and there will be osmotic diuresis, encephalopathy, and Kussmaul breathing will be there. Thank you.